Okay, we were discussing the general anatomy of the nervous system, and now we come to autonomic nervous system. You know, somatic nervous system is being concerned with the supply of the soma of the body, that is skeletal muscles, and then bones and joints and skin, etc. While the autonomic nervous system, as its name indicates, it is being concerned with the activity of the internal viscera of the body, like the heart, the stomach, the intestine, urinary bladder, etc. And these organs are acting, but their activity is not under our control. It is not under the will of the human body. That's why it is called as autonomic nervous system or involuntary nervous system. Their activity is under the control of the nervous system, the central nervous system, but not under the control of the will of the human. Okay, that's, for example, if there is severe exercise, much blood is being needed to the muscles, then the nervous system orders the heart to please become more active to give more blood supply to the muscles at that time needed. That is under the control of nervous system, but not by our will. Okay, this is autonomic nervous system, and autonomic nervous system is then being divided into two: sympathetic and parasympathetic. Note, autonomic nervous system or involuntary nervous system are the system of the nerves being concerned with the activity of those organs which are not under the control of the will, that is being divided into two: sympathetic and parasympathetic. Note the point. The name sympathetic, which is given to the system, that is actually not sympathetic, that is actually non-sympathetic, because it is the system being concerned with the fight, terror, and emergency condition, while the parasympathetic system is being concerned with normal, when there is no special activity and neither any flight or any fight is being done. That is being controlled at that time by the parasympathetic, while in condition of emergency and fight, the system is being controlled by sympathetic. That's why it is actually not sympathetic, but it is actually non-sympathetic. Okay, in general, to know the functions of the sympathetic and parasympathetic, look at this chart. I told you that sympathetic is the system of fight. You are standing in front of the enemy, while the parasympathetic is actually the system of comfort and stability. So, when you are standing in front of the enemy, what will be your heart rate? Definitely, it will be increased. Sympathetic increases the heart rate, while the parasympathetic, in relaxed condition, you are sitting quite normal, heart rate will be normal. The blood pressure, when you are standing in front of the enemy, the blood pressure increases, and in relaxed condition, the parasympathetic, that is the parasympathetic, normalizes the blood pressure. Then when you are standing in front of an enemy, how will be your face? It would be pale. That is because of the blood vessel gets constricted. This is vasoconstriction being done by these sympathetic nerves. Sympathetic nerves are motor for blood vessels. That is vasomotor or vasoconstrictor. That's why the face becomes pale. While the parasympathetic, when you are in less condition, your face is flushed. That's why they are vasodilators. Okay, but note the point at this time that when the heart rate is increased and you are in the condition ready for fighting or fighting, At that time, the blood needed by your heart as well and by your muscle would be more than normal condition. That's why the sympathetic is vasomotor or vasoconstrictor for the blood vessels, but for the blood vessels of the heart and for the blood vessels of the skeletal muscles, it is not vasoconstrictor but vasodilator, so that during condition of exercise and fight, more blood is being given to the heart, to the brain and to the skeletal. Otherwise, the sympathetic is vasoconstrictor, while the parasympathetic is vasodilator. That's why during relaxed condition, your face remains flushed or red. And then your mouth remains dry. When you are standing in front of an enemy, your mouth becomes dry. That is the sympathetic. The sympathetic is inhibitory for salivation. While the parasympathetic, the one you are quite relaxed, your mouth is moist, that is saliva. Salivary glands are being, the glands are the parasympathetic is secretomotor for the salivary glands. At this time, you must one another point. Note, the parasympathetic is secretomotor for all the glands except the sweat glands. Okay? This part also must be clear to you. For the sweat glands, because in front of the enemy, you start sweating. And that is because the sweat glands are being stimulated by sympathetic, and at this time your sympathetic system is being stimulated. That's why the sympathetic is secretomotor for the sweat gland. Otherwise, for almost all the glands, the parasympathetic is secretomotor. Then the pupils. What is the effect of pupil? Upon the pupil, the sympathetic and parasympathetic. Note one point. Standing in front of enemy, वो कहते हैं ना कि आंखें निकाल लेते हैं उसी की वजह से. So pupils are dilated, and sympathetic causes pupillary dilatation, while the parasympathetic causes constriction of the pupil. And this you would remember this way: standing in front of enemy कि भाई आंखें निकाल लो. So that is dilatation of the pupil, while the parasympathetic causes constriction of the pupil and accommodation of the lens. For example, as you are studying. Or you are quite relaxed, studying a newspaper, then your pupil will be constricted and the lens will be accommodated. That is the function of parasympathetic. Then the sweat glands, again I told you, the sweating is being increased by sympathetic, while in parasympathetic condition the sweating remains normal. And then hairs, in condition of fright or condition of strange happening, what happens? कि बाल कड़े हो जाते हैं. Pylo erection of the hair follicle or hairs. So the sympathetic causes pylo erection. So sympathetic is motor for the sweat glands, secretomotor. It is motor for the hair follicle, pylo erector. Okay. While in parasympathetic condition, the hair remains normal. And then when you are relaxed and you are having breakfast, for example, on the weekend, what happens? What will be condition of the heart, the stomach and intestine? They will be start contraction and functioning. And at the same time, when the stomach contracts, the sphincter must be relaxed so that the food can go forward. So it means that the parasympathetic is motor for the smooth muscles of the viscera, and it is inhibitory for the smooth muscles of the veils or sphincter. For example, pyloric sphincter, celiac sphincter, okay, etc. While the sympathetic, when you're standing in front of an enemy, the organs are being quite, they are not active. But the sphincter must be closed so that at that time, it's not the time for urination. That's why the sphincter must be closed. So, the sphincters, for example, urethral sphincter, the pyloric sphincter, the celiac sphincter, etc., the sympathetic is motor or activator, while the parasympathetic is inhibitory. This is in general the functions of the sympathetic and parasympathetic. Okay, now before going to this, again one point note that the somatic nervous system is being concerned with supply of the soma of the body, while the autonomic nervous system is being concerned with supply of the internal viscera, heart, stomach, etc. There is one anatomical difference special in the two. In the somatic nervous system, the nerves originate either from the brain, cranial nerves, or from the spinal cord, spinal nerves. Their nuclei are the central connector cells, which are either motor or sensory. It lies in the brain and in the spinal cord, and from those cells or neurons, the nerve come out, and it, whether sensory or whether motor, it directly goes to the target organ. Okay, for example, the muscles of the upper limb and lower limb. Okay, in the same way, in the spinal cord, the nerves originate, the spinal nerves originate, and they go directly to the soma, that is to the muscles, to the skeletal muscle, to the bones, and to the joints. While in autonomic nervous system, note the point specially, whether it is spinal or whether it is cranial, the nerve, for example, this neuron which lies in the brain or in the spinal cord, from this, the autonomic nerve which originate, then this autonomic nerve which originate, it do not reach to the organs, that is to the smooth muscles of the intestine or to the stomach, but on the way they first relay in a ganglion. You know what is ganglion? It is the collection of neurons outside the central nervous system, that is ganglion, and collection of neurons inside the central nervous system, that is the nucleus or center or connector cells. So the first relay in the ganglion, and after the ganglion, again the fibers originate. These are called as postganglionic fibers. These are called as preganglionic. These are preganglionic. These are postganglionic. This is preganglionic neuron. This is postganglionic. This is neuron. And then this postganglionic fibers, nerves, which after relay in the ganglion, they would supply the intestine or the stomach, etc., and then they would work. Otherwise, if the autonomic nerve is not relayed in the ganglion and coming out from the central connector cells which is present either in the brain or in the spinal cord, and if originating from the central cell, it directly reaches to the target organ, for example the intestine, then the muscles in the intestine are normal. The nerve is also normal. The central connector cells are also normal. But because there is no ganglion in which the nerve first relay, then this part of the intestine, the muscles of that part of the intestine would not work. It will not function. For example, a condition which is called as congenital megacolon. Congenital megacolon are also called as Hirschsprung disease. Hirschsprung disease, in which in some part of the intestine, especially the descending colon and maybe part of transverse colon, there is no ganglion in which the nerves can relay, and then the postganglionic nerve should reach to the muscles, because there is no ganglion, and that's why the nerves reach to the muscles, but without relay. That's why that part of the intestine do not function, they do not contract. So the point is that the somatic nerves have one neuron and then directly to the target organs, while the autonomic nerves, first neuron present in the central nervous system, another neuron present outside the central nervous system, either in the sympathetic chain or in the wall of the viscera, or So in the head and neck there are some ganglia which are present also outside the viscera. There are 4 ganglia present there. This I will discuss in the other detail. Okay, now we come to the sympathetic nervous system. Okay, sympathetic nervous system. The function of sympathetic nervous system, it is a system of fight, flight, and terror, and stillness. Okay, and it prepares the individual muscles, heart, and everything for the fighting conditions. It inhibits this. It stimulates the sphincter so that the sphincter do not get relaxed. Okay, so where is it present? Note the point. In the somatic nervous system, the motor neurons are present in the brain and in the spinal cord. Okay. While in sympathetic nervous system, note the point that sympathetic nervous system is the central or connector cells, or the central nervous system part of the sympathetic system is only present in the lateral horn cell of the spinal cord, and only in the thoracic and L1 and L2 segment of the spinal cord. Note this statement which I did, and now I explain. Okay, the spinal cord present, it is present in this spine, the vertebral column. That's why it is a tubular structure like that, exactly, and continues with the brain through the medulla oblongata, and present in the spinal cord, which is a tube-like. And it consists of the part of the spinal cord present in the cervical region, the part present in the thoracic region, the part present in the lumbar region, and in the sacral region, and in the coccygeal region. That's why we say, look, this is the cervical segment of the spinal cord, this is the thoracic segment, and this is the lumbar segment, this is the sacral segment, and this is the coccygeal segment. And look, the spinal cord is then being divided into 31 segments, and one segment actually means a small piece of the spinal cord which gives origin to one nerve on the right side as well as on the left side. This is that small piece of the spinal cord that is being called as one segment. In this way, there are 8 cervical nerves of the spinal cord, 12 thoracic nerve of the spinal cord, 5 lumbar nerve, 5 sacral, and 1 coccygeal. The same are the segments of the spinal cord. 8 segments of the spinal cord, 1, 2, 3, and this one. 12 segments of the thoracic region, 5 segments of the lumbar, 5 segments of sacral, and 1 coccygeal. Total 31. And 1 segment is that small piece. Look, this piece from which the cervical 1 nerve will originate. Before going into sympathetic system, again, when you do a cross section of the spinal cord, you will note that inside the spinal cord, the gray matter of the spinal cord is being arranged not like this, but in a way that, look, the cells are being arranged like this. Look, like this, so that it is having like this. Look, one process extending like this, one like this, and over here are present these neurons. And this is being called as ventral root of the spinal cord, ventral horn of the spinal cord, or anterior horn, and this is called as posterior or dorsal horn of the spinal cord. Horn means that small piece in which the neurons are lying. And the neurons lying over here, these are being called as posterior horn cells. Means nothing that the cells which are present in the posterior horn, and these anterior horn cells means nothing but the cells which are present in the anterior horn. Now what happens, that the fibers which originate from the anterior horn, these are motor in function because these neurons are motor, and the fibers which originate from the dorsal or posterior horn, these are sensory in function because the cells are sensory, and these two unite with one another inside the vertebral canal, and one nerve is being formed which consists of sensory fibers and motor fibers. Sensory fibers coming from the posterior horn cells and motor fiber coming from anterior horn cells, and then one nerve is being formed which come out from the spinal cord like this, and each nerve consists of sensory and motor fibers. Okay, but note the point that the segment of the spinal cord in the thoracic region and the segment of the spinal cord in the lumbar region, over here when you do lumbar 1 and lumbar 2 region, only from here, from thoracic to lumbar 1 and 2 in this segment, if you draw a cross section, you will find that the gray matter is arranged like that again it consists of neurons arranged over here, which is being called as anterior horn cells, neurons arranged over here which are called as posterior horn cells. They are sensory, these are motors. And in the lateral part of the spinal cord of the thoracic region, over here, in the later part of the spinal cord of the thoracic region and L1 and L2 region, there are a group of cells present in the lateral part of the spinal cord as well. Where these lateral group of cells, these are not present in the cervical region and not present in the lower lumbar and in the sacral region. These lateral horn cells or group of cells in the lateral part of the spinal cord are only present in the thoracic region and first lumbar segment and second lumbar segment. These horn cells which are present in the thoracic region, these are sympathetic in function. These are sympathetic in function, and these are being called as sympathetic in function. And these lateral horn cells of the spinal cord present only in the thoracic region and in the first two lumbar segments. These are being also called as central connector cells of the sympathetic system. Okay, now what happens before going to detail in this more? Now I explain one part more. Look, this is the vertebral column, vertebra. This is transfer process of vertebra. In the same way, many vertebra with transfer processes like that. Okay, up to here. And inside the vertebra lies, inside the vertebral canal, in which lies the spinal cord. Now, on these transfer processes of, and over here, over here is the skull, and this is the base of the skull. Okay. So note the point that extending from the base of the skull, till over here, till the coccyx, there is one chain. Sorry, this is not working properly. This is one chain, that is nerve fibers with a ganglion, and then nerve fibers and ganglion, and so on both sides of the vertebral column. On the posterior wall of the thorax and abdomen, there is one chain, like the chain like the chain of tasbih, in which there is one fiber in which the tasbih are being put. In the same way, on each side of the vertebral column and the posterior thoracic wall and the posterior wall of the abdomen, is lying one chain having ganglion and nerve fibers, and the ganglion are all being connected with nerve fibers. This is being called as sympathetic chain. Sympathetic chain are also being called as sympathetic trunk. This lies on each side of the vertebral column, and it consists of ganglion being connected with one another by the nerve fibers, and that's why it is being called as the sympathetic chain and sympathetic ganglion. This sympathetic ganglion consists of, as I told you, the ganglion and the fibers, and it is said that 3 ganglion are present in the cervical region. In the cervical region over here, only 3 ganglion, that is superior, middle and inferior. 3 ganglions, superior, middle and inferior. And it is said that actually the number of ganglion is the same as the number of the nerves. But there is fusion of the nearby ganglions with one another. So it is being assumed, it is being said that the upper 4 cervical ganglions, upper 4, unite with or fuse with one another to form the superior cervical ganglions. The middle 2 unite with one another to form the middle cervical ganglions, and the lower 2, total are 8, unite with one another to form the inferior cervical ganglion, and inferior cervical ganglion usually unite with the T1 ganglion, usually, and combined it forms inferior cervical ganglion or stellate ganglion, star-like ganglion. This is also being called a stellate or star-like ganglion. Over here is the fusion of the cervical 7 and cervical 8 ganglion, and along with this thoracic 1 ganglion, that combined it forms the stellate ganglion or inferior cervical ganglion. And then it is said that in the lower part of sympathetic chain, in the thoracic region there are 11, and the lumbar region there are 4, and the sacral region there are 4, and the coccygeal region over here there is 1, in which the 2 sympathetic chains are being united over here at this ganglion. It is also called as ganglion impar. The lowest ganglion in which the 2 chains being unite. So in this way, in the cervical region there are 3 sympathetic ganglion, and the thoracic and lumbar and sacral region there are 1 ganglion deficient as the number of the nerves. That is, the lumbar nerves are 5 and ganglion are 4, or so on. Okay, now what happens again? Now come to this area. Look again. This is anterior horn cells, this is posterior horn cells, and over here is the lateral horn cells. Okay, lateral horn cells. This is motor in function, this is sensory in function, and that is the sympathetic. Now what happens? From these dorsal cells, the nerve fibers originate, which make the dorsal root of the nerve, spinal nerve. From the ventral, these fibers originate, which form the ventral root of the nerve. These are motor in function, these are sensory in function. And from these lateral horn cells, fibers originate, which are sympathetic in function, but they come out through the ventral root. In this way, in the thoracic region and the upper lumbar region, the ventral root when comes, it consists of 2 types of fibers, motor and sympathetic. While in other part of the spinal cord, that is in the cervical and lower lumbar and sacral region, the ventral root consists of only motor fibers. And these thoracic root consists of the motor and sympathetic fibers. And now the 2 roots unite with one another. 2 roots unite with one another to form one nerve. And now this nerve consists of, I make it over here. Now this nerve consists of 3 types of fibers. Look, the upper fibers which are sensory, the lower fibers which are motor, and the middle fibers which are sympathetic. Okay, and now you know over here is present the sympathetic chain with its ganglion. And I told you that the autonomic nerve, whether sympathetic or whether parasympathetic, it must relay in the ganglion before it reaches the target organ. So what happens? That the nerve, when it comes over here out of this vertebral foramen, immediately it sees the ganglion, and sympathetic fiber says, "Oh, this is my poopy." So the sympathetic fibers tell to the other ones that, okay, you wait, I first go and reach and to this my relative poopy. So these sympathetic fibers leave the spinal nerve and enters into the ganglion and relay over here. After relay, it again comes back to the nerve and joins the nerve. So the part of the fibers coming from this central connector cells in the lateral horn till it reach to the ganglion, these fibers are called as preganglionic, or also called as, these are myelinated, are white in color, and these branch from the nerve to the ganglion, usually distal. That is also called as white ramus communicant. That is, the ramus are branch from the nerve which is white and given to the ganglion, and then from the ganglion back it comes, but in the proximal direction. From overhead it comes like this. And this part of the sympathetic fibers which have relayed in the ganglion, these are being called as post-ganglionic, are gray, because now they have no myelin or very less myelin, so the color is not yellowish or white. That's why this part is post-ganglionic and are gray. And now from this onward, the spinal nerve now consists of three types of fibers: sensory, motor, and post-ganglionic sympathetic fibers. Each spinal nerve must have now these three types of fibers. This is a must. Each spinal nerve consists of sympathetic and then the sensory and motor. So spinal nerve is in this way having three components. Okay. Now the question arises that, okay, in the thoracic region is present the lateral horn, and in the number 1 and 2 region, that is present the lateral horn. So thoracic 1 to 12 nerves, and L1 spinal nerve and L2 spinal nerve, that will receive the preganglionic fibers from the lateral horn cell in the spinal cord, and then the postganglionic fiber from the ganglion itself. Then I told you each spinal nerve must have sympathetic nerves. Then where from sympathetic fibers are coming to the cervical region and to the lower lumbar and sacral. Note this part. कहाँ से आते हैं? Okay. Now look. This is again the spinal cord. This is thoracic segment, and this is L1 and L2. That is thoracic segment 12. And over here is the sympathetic chain in the cervical region, and then in the thoracic region the cervical chain, the sympathetic chain, and in the lumbar region and sacral region, and so on. Now what happens? The sympathetic fiber that comes out from the lateral horn in the concerned spinal nerve, for example in the thoracic 1, thoracic 2 and thoracic 3 nerves, what they do, they leave the spinal nerve as white ramus communicant and reach to the ganglion. Now these fibers which come out from the T1 and T2 these fibers leave the nerve, reach to the ganglion. Some of the fibers, sympathetic fibers, relay in its own ganglion and come back to its own nerve. But some of the fibers do not relay. What they do, they ascend upward to the cervical region and descend downward to the lumbar and to the sacral region, and they pass after its own ganglion, who do not relay in its own ganglion, but they pass downward through the sympathetic chain without relay, and they relay in the ganglion above the thoracic region and below the thoracic region. In this way, each ganglion receives the preganglionic sympathetic fibers. Each ganglion receive the preganglionic sympathetic fibers, but the thoracic ganglion and the upper two ganglion receives this preganglionic thoracic fiber from its own nerve, because its own segment of the spinal cord is having the sympathetic fibers. But the ganglion above the thoracic segment and below the lumbar segment, lumbar 2 segment, these fibers which coming from in each nerve, some of the fibers relay in its own ganglion, and the rest fiber descend to relay in the ganglion below. Over here do not relay all, then some descend to the other ganglion, some descend to the other ganglion. In this way, all of the ganglion receives the preganglionic fibers, okay, either from its own nerve or from the other from thoracic segment by ascending this fiber in the sympathetic chain. But one another point, that the cervical nerves, because it do not have the sympathetic chain, sympathetic fiber in its segments, that's why the cervical nerves, while coming out of the intervertebral foramen from over here, it would not be having the preganglionic white fibers. Only after the ganglion, the cervical nerves would be having the postganglionic sympathetic fibers. In the same way, the L3 and 4 and sacral nerves, all of them would not be having, while each nerve coming out of the spinal cord, it will be having only sensory and motor fibers, but no sympathetic fibers. But when it reaches to the sympathetic chain and get the postganglionic fiber from the sympathetic ganglion, then onward it would be having the postganglionic sympathetic fibers. This is another point. Now, another point is that because the sympathetic ganglion in the cervical region are 3 and the nerves are 8. So it is said that the first cervical ganglion, because it is being made by the fusion of the 4 ganglion, that's why it will give postganglionic fibers to upper 4 nerves. Cervical 1, cervical 2, cervical 3, and 4. All of them would get the postganglionic fiber from the first cervical ganglion. Then the 5 and 6 nerve will get the postganglionic fibers from the middle ganglion, and then inferior cervical ganglion will give the postganglionic fibers to the lower 2 spinal nerves. Okay. Then the more discussion that what are the distribution of the fibers of the sympathetic chain, I think I should do in the next lecture. This would be sufficient primary to be digested by you for today. Thank you.